Thank you for joining us again. This is our webinar for the afternoon on the topic of data system disruptions. And I'm Amy Nicholas with the DaSy Center, and happy to be joined today by Susan Kessler with Alaska's Part C program and Michelle Ogorek from Wisconsin's Part B 619 program. So we're going to just open with a little bit of sort of background information about the types of events that can cause data system disruptions. What do we mean when we say a data system disruption? Trying to build understanding about the various impact that those disruptions can have on operations, management, and accountability from the perspective of Part C and Part B 619 programs. And then talk about some actions that can be taken when when you're preparing for or even responding to a disruption that occurred. So Susan and Michelle are here today to share their firsthand experiences with two very different types of data system disruptions that their programs have experienced in the past year, really. So just to start, so Part C and Part B 619 programs rely on their data systems to support all sorts of different activities. And obviously disruptions to those systems can really jeopardize access to accurate information. A data system disruption we define as any event or circumstance that limits or restricts a data system from being accessed or used as planned. A variety of different events or circumstances, as we saw with COVID-19, many people experienced these disruptions, can cause a disruption. Disruptions may or may not be avoidable. The programs may not have any warning about them. These could include natural disasters. This could be things like when you're deploying a new data system application or an enhancement to it. It could be an unsuccessful deployment. There could be bugs to it. It could be delayed. There could be planned or unplanned departures of key staff people related to your data system. Or there could be external technical disruptions like malicious attempts to access the application. So before we get to the potential impact, just curious, we're going to do a quick poll. How many of you have experienced disruptions in your program? So you'll see a poll come up actually on the slide there. If you've experienced any of these events or circumstances, or if there's others that are not listed directly here, we'd love to see. I got a couple of folks. And Mallory, when we end, are you able to publish the results?
Yeah, I sure can.
Okay, great. We'll give just a sec. Look, a couple people are still responding. Okay, if you want to go ahead and we can end that and publish it. So looks like we have a little bit of a mix of folks who responded here about the types of events or circumstances that have caused disruptions for their programs. Again, just because COVID-19 happened to all of us, it doesn't mean we all experience disruptions. We know not every program necessarily had big disruptions, data-related disruptions to COVID, but that's probably one of the most common ones. So we're going to talk about different ones today, though, and you'll hear about different ones from Susan and Michelle today. But in thinking more about, these disruptions, and they can have either isolated or large-scale impact on a program's data system. So the consequences can really range from things that are easily addressed very quickly to things that require long-term intervention. So some of the potential scenarios of how a disruption could impact a Part C or Part B 619 system. There could be damage from an event, physical damage that causes partial or complete loss of technical equipment, child-based records, other program documentation. Users have limited access to a data application during many types of disruptions, power outages, the system is offline longer than it's expected to while we're waiting for an update to deploy. All sorts of reasons why people can't access the application to get to do what they need to do, to be able to enter or retrieve the data that they need to access to. Reporting deadlines or or timelines could be missed. So this could be either just inability to get the information you need to generate the required reports, or you're missing timelines in terms of entering needed data for those reporting needs, or maybe it's a disruption that providers can't get in touch with children or with families to deliver services. They don't have access information if there's not paper backups, things like that. So just a couple of examples of different types of impact. It's hard to say that it's just that these disruptions always cause the same type of impact, because they vary so much in the nature. So when we talk about a data system disruption preparedness, so preparedness refers to proactively developing a set of actions that programs can take, leadership in this case, to avoid or even minimize the potential adversity when faced with these data system disruptions. The actions can include physical, policy, procedural, training preparations. Some steps can be taken before a disruption occurs, and others may need to be taken in a reactive way. Having plans in place to do with what you're going to do before and after disruption occurs can really help mitigate the negative consequences. When we think about data system disruption preparedness, we categorize them into three main areas. So we talk about preparing users, we talk about preparing our processes, and we talk about preparing our technology. So obviously users need to be prepared for these disruptions by receiving necessary training and communication about what to do when they occur. Processes need to be established and documented so that users know what to do when they experience disruptions. And the technology, the data applications that we use need to be designed to be able to make necessary changes that could minimize the consequences associated with disruptions. So what can be done before a disruption occurs? Proactive steps that program leaders can take include developing and distributing a set of case record level templates or forms for alternative local data entry of essential case management information. Documenting the circumstances under which the state will support any kind of local data entry. That's also another preparation step. Establishing processes for scheduled data application updates and emergency updates, sort of like standard advance notice given to local programs, a minimum amount of time. Using multiple methods to administer advanced communication about planned downtime of an application. Some folks use FAQs, a splash page, to have webinars, things like that, to make sure that folks are prepared about an upcoming downtime. Another thing that can be done is to ensure the contract you have with your data system vendor, if externally, includes flexible support during the operation and maintenance period, so that when you have to make changes, you can make them easily, and you have the ability to get the response that you need to get the things about your system changed in a timely manner. So after disruption occurs, there are different things you can do to help mitigate negative effects. Some of those recommendations include issuing timely and ongoing, not just initial communication to local programs regarding the nature of the disruption and what exactly it's impacted. So initial information about the event and time and date estimates for restoration or recovery. Help local programs plan for catching up on data entry, as we mentioned, including adjusting timelines for required submissions or things like invoices for contractors, coordinating and supporting local programs in conducting all of their required meetings and planned service delivery to the greatest extent possible and in a timely manner. So even if actual data entry for those encounters may be delayed until the system application is available again. It's also good to get information from your local programs, not just give them information about these disruptions. Ask them to submit written details to you describing specifically how the disruption has impacted them. It's really useful when a disruption might trigger the need for a descriptive APR note or something along those lines. So we've heard a little bit of background there about the types of disruptions, potential impact, action steps for preparing and responding. So we're going to hear directly now from two states, again, as I mentioned, with two very different experiences. So I'm going to pass it to Susan Kessler. Susan is, among other things, the Part C data manager in Alaska. And Susan, just let me know when you want me to advance.
Sure, thanks for the opportunity to be here and share our experience. A lot of you may have already heard that Alaska has had a data outage. We've been talking about it for a while, but I can give you the details. So you could go to the next slide. So just to give you a little bit of an overview of our data system, we do everything we possibly can within our data system, and we're really proud of our homegrown system that our developers, who are state staff, have spent years making for us. This is what it looks like. And if you go to the next slide, I can show you some of the functionalities. We collect all child data in here, all of our service data. We do all of our SPP APR reporting from here. We keep really close monitoring through quarterly reporting with all of our 15 local programs that we work with. We also have a couple automated data sharing features with our partners, including DEED. We do our Part B or Indicator 8B notification data through here, and we also receive data from child protection. All our captor referrals come to us from within our data system. We also have a couple other things related to billing. We generate reports for targeted case management billing and Medicaid administrative claiming. And we, in Alaska, children move around our state quite frequently. And so within our data system, we're also able to easily transfer all child records. So you can see that we use our database a lot. And we had a period of data disruption that has lasted more than a year, started in May of 2021. And just last week, we finalized our new database application, although it's been kind of partially working for a couple months. So you can go to the next slide. Yeah, so here's kind of our timeline. It was a result of a cyber attack that wasn't just, we weren't the only program in the state to be impacted. It was the Department of Health and Social Services. And so this has been a major impact to the state across programs. What happened for our database application, it was pretty aged and we were already looking at development of a new database application. And so when this database disruption occurred, we did a lot of security testing. And at that time, it was determined that the platform we were using was kind of outdated, and the amount of work it would take to upgrade the security for the system was more than we really wanted to invest at that time. And that we were better off moving to a new platform and developing a new database application. So to be clear though, our database itself remained the same, but the application we use to access that data and enter that data and manage that data is what we've developed anew. And so yeah, we're happy to be moving forward from this. And now, you know, when I heard Amy's list of all the things that we should be thinking about, I can't say that we've done all of those yet. So this is good learning for me as well, thinking about what are our next steps. So go ahead and go forward. So how that's really impacted us as a state, not having our data available to us, we were able to modify some of our federal reporting. So this is something I wasn't aware of, but we were able to submit a partial year of SPP APR data. And that's just something good to file in the back of your head in case you ever lose a chunk of data. You can make a case for submitting a partial year. And so then also one thing that happened to us with our federal reporting is we were, for some of our reporting, we initially turned in partial data, and then we were able to clean up and really clarify our full data set during the clarification period. So that was really helpful. I do know that's going to be going away, but we will have a bit longer to get our data in. The other thing to think about is that during the time that our database was down, we didn't have access to any of our back data unless we had downloaded it into a more usable format like Excel. So that's something I've really grown into the habit of doing is downloading data sets more regularly, things that I know I'm going to want to have access to in the future. Let's see. So yeah, functionality from old application had to be completed in alternate ways during disruption. So this is that future planning that we wish we had done. Local programs had to ensure that they were able to collect all the data that they normally put into our application. in alternate ways. And in Alaska, we were able to allow programs to do that in their own way. And we're a pretty small state, but it's definitely something to think about for especially a larger state. There's advantages and disadvantages of programs being able to do that in their own way. I think if I had it to do over again, I might consider more standardization of their ongoing data collection. You know, what we're learning though with our grantees is a lot of them are using electronic health records. So many of our programs really already had all their data in another place. And we'd hate to ask them to duplicate data entry unnecessarily. So it's just something to think about when you're doing your planning. And the other impact I would say is it's definitely stressful to not have a database for a period of like 15 months. It's extremely stressful, not only for state staff, but also for our programs. So next slide, please. So when we look at the impacts on our data quality, that's something I think that, you know, we should definitely think about if you are looking at a data outage, and maybe ahead of time, but also afterwards, really consider how a data disruption could impact the accuracy, completeness, reliability, relevance, and timeliness of your data. So I'm finding some of our data now, you know, from a year ago, it's not really very useful anymore in some ways. So we still have to have it. But those, I think, are just things to consider when you think about your response to a data disruption. Next slide, please. And then thinking about, you know, what would your alternate ways of collecting data be? And probably it won't be one method. It will probably be many methods, depending on the data set, depending on the purpose of it. So we used a lot of Excel spreadsheets. One thing we learned the hard way is that some programs are more adept at using spreadsheets than others. And so for some of our small programs, they don't have skills and training in using Excel. And so really making sure that you've blocked down fields and made it as easy as possible for programs to enter exactly what you're looking for. We did rely a lot on existing local data systems like electronic health records. Some programs went really old school and did a lot on paper, and we are still somewhat paper-based or electronically, like PDF paper-based. We went back to faxing things like Part B notifications that, you know, had been happening electronically. We had to make sure we had really, and this is still a little struggle for us, secure email is a struggle only because each of our grantees really had their own secure email system. And so there's just so many secure email systems out there. I have considered whether we would want to have one single secure email that we require all of our programs to use. I also have come to really love data drop portals where I can upload a data set to a program and they can pick it up, or they can upload a data set to me. And we use our database in that way with programs. But a large data set, even if you have secure email, you can't really email a large data set in that way. So that's something to think about. Online platforms like Google Forms, if you have a HIPAA compliant version, can be really useful. And I think that really considering each program and their capacity to change and implement the strategies that you select is very important. Like I said, we have some very small programs. One thing to think about is that when you do have a database disruption, all your back data has to get entered at some point, or at least in my opinion, it did in our state. I needed to have all their back data. And so our programs in Alaska have been entering a year's worth of back data and then cleaning it and assuring that it's all, you know, ready to go. So they actually still have a couple more months to finish that process, but it has been a very heavy lift for them. And in fact, we've actually had state staff go out for some programs and assist with actual data entry. Next slide, please. So I would say, the biggest thing I learned through this data disruption is that it's really important that everybody is talking to each other all the time, that your local programs feel heard about what's realistic for them, about how stressful it is for them, that your leadership within the state hears how things are going and is being regularly updated about how your services are being impacted. I think having written agreements in place before a data disruption could be important, but also just regularly emailing everybody who's impacted on the status of the data disruption is important. One thing that has been really effective for us in Alaska is having user group meetings. So we have kind of two levels of our user group meetings. We have a database work group, and these are kind of front desk people who are entering data entry technicians, meeting with us at the state to talk about what they're encountering as they enter data into the new system and helping us refine it. And when things got really fun is when we started inviting our IT folks to that meeting, and they could hear directly from users who were entering data how their experience was going, what changes they would like to see. And even small changes can really help engage your users. Like the date format is something we tried several different date formats for entering dates until finally our users loved it. And small things like that are really important for engaging users. The other thing I'll say, that within our state, we really needed to have a team that went up as well as down to those users. So having support from your state management and my supervisor, Pam Kellish, is on this call, and I know she's always advocated for us as we've gone up the chain within our state office to prioritize our project, especially when we had such a widespread disruption to our system in Alaska. We were able to stay a top priority for IT support, and that really takes some advocacy from your leadership. Yeah, so, lots of different people need to be on your team. And then, individualizing support. So we've done a lot of data training since our data disruption on how to enter data, how to generate reports. Recently, we did a data cleaning workshop. So how do you ensure that your data is accurate? So just lots of training, but then individual programs, we have lots and lots of Zoom calls. Some programs need a huge amount of support and others pick it up and run with it really quickly. So it's not going to be one size fits all. Next slide, please. So things I wish we had done. I think one thing we need to make sure of is that you're looking at your security and understand what your security features are and how your security is being tested before you have a problem. So in our state, this was a security-based data disruption, and I think our state, I'm sure, has lots of ideas about what they wish they had done. But now we're moving forward and we're really clear about what security features we have in place. Also, I wish that we had better backup strategies in place before this happened for our local data collection and for our previous data sets. So also thinking about, if your data system goes down, how are you going to receive any data that normally comes directly into your system? And how would you push out data in a different way if you didn't have your data system? And I would really push for, rather than using spreadsheets for collecting data from programs, using something that can be more of a form style that's really easy for them to work with. Manuals, we are slowly getting all of our database user manual is complete, but now we're really working on an overarching manual to show how our data application is designed, how all our fields fit together, and a part of that will be what our alternate strategies are in case of another data disruption. And then the last part is just, remembering to really keep very tight control over who has access to data in your data system on the user end. And we've gotten much more thoughtful about how we grant access to individual users and how we monitor their access as well. So I think that's my last slide. Excuse me. I hope you can feel free to reach out if you have any questions, or if you find yourself in a data disruption and want ideas, feel free to reach out. Thank you.
We welcome any questions you may have for Susan now, or if you also want to hold them to the end. Your new system, Susan, is it cloud hosted? It is.
Yeah. Well, yeah. I mean, our database is on a SQL server. So I guess the answer is no. It's not really cloud-based.
Okay, I'm going to switch gears. I don't see any questions in the chat, but holler at me if you see any. Okay, we're going to switch gears to Michelle with Wisconsin 619, a very different kind of data disruption experience. So Michelle.
Okay. Hello, everybody. I'm Michelle Ogorek. I'm from Wisconsin, and I am the statewide early childhood coordinator. So what that means is I work in conjunction with the 619 coordinator, and I work on all of the early childhood indicators and pretty much anything else that needs to take place. So you are going to see this from not the lens of a data manager. You're going to see it from the lens of a person that does more training and professional development and technical assistance. So since in Wisconsin, it's fall and it's the end of October and beginning of November. So that means that you never know what's going to happen the first snow. So I thought I would kind of tell a story about an extremely big blizzard that we had at one point. So where we started is we were really moving through the process of, I'm particularly going to talk about indicator 7 child outcomes. Things were going actually pretty well. We thought we might make a few changes. We'd done some data digs, and there were a few things that were thought that we needed to have some differences on. So we really had great intentions. We were really excited. What we just wanted to start out with was we wanted to do a state reporting change where typically in Wisconsin at age 6, that's when our indicator 7 children exited. And we did our homework, and we realized that we were one of the few states that were actually still doing that. And so we were going to have it when kiddos entered the year before entering kindergarten. So we have universal pre-K and 4K. So at the end of the 4K year. The other thing we wanted to do is we wanted to really start making our indicator 7 data a little bit more useful for LEAs. LEAs take a lot of time and resources working on indicator 7. So we wanted to have something that would be useful for them to be able to start making maybe some programmatic decisions or hypotheses or things like that. So we did our homework. We looked at other states, what they were doing. We looked at pros and cons. We actually connected with national TA organizations to find out what other states were doing in addition. And then actually we got pretty lucky. I think it was DaSy and ECTA came out with a cohort to look at indicator 7 and child outcomes. So of course we applied for that. We were approved. So life was good. We were really ready to jump in, and we of course had not anticipated anything. So next slide. Then the perfect storm hit. So first COVID hit, and you would think that that would have been the big upset. We weathered pretty well through COVID. We really we had limited impact on our data. The process was pretty much in place, and people were really doing well with that. LEAs were doing well. We had some missing data and things had come up, but our State Department really kind of did all hands on deck, and we really came out with some really great things. So that was not our storm. But what happened is we had COVID, and then we had 4 other things happen, which really created this storm of turning into a blizzard. So first thing that happened is, as I talked before, we were just starting out with the state reporting changes. So there, with relation to the age, we did find out when we were in the process of doing that there were some big cracks in our system, and it had a little bit bigger impact than we had thought. Then we also thought we were going to do some data enhancements. So we have a standalone indicator 7 application in Wisconsin. And what we were going to do is we were going to start developing some reports that the LEAs could use. Now in Wisconsin, we have really done a good job at taking our indicator 6 data, our preschool educational environmental data, and we really use it extensively, and we use it for technical assistance and training, and we do some really great things with that. So we thought, well, of course we want to do that with Indicator 7. So we were working on a lot of enhancements with new reports and looking at using progress categories and summary statements and how LEAs were going to be able to use them, and develop a big training package that we were going to push out across the state. Well, we ran into a few bumps there. We had some issues with the application as we were designing the new reports. We had some disruptions. We had a period where it was the data wasn't pulling from the correct places, and yet it had already rolled out. So we had a lot of different bumps along the road there. Then we had a huge disruption. We had our data manager, who had been with us for 35 years, retire. Now, you would think that that person had been here for 35 years. So historically, they had been through kind of everything. They were extremely efficient. They were able to keep everything happening. From the perspective from my perspective, whenever anything was asked, it was just always there. So that was something that when the person retired, we realized a few things that we need to do a little bit differently, and I'll get into that in a few minutes. And then the fourth one, which actually was a disruption, but I think it was a blessing in disguise. So we restructured our preschool discretionary grant. So in the past, our preschool discretionary grant had been very regionally located. So every single region had a program support teacher, which provided training and technical support around the early childhood indicators and other things. So we then restructured our grant, and now the grant is a little bit more state structured. So we have technical assistance providers that go around the state. They don't have a particular region, and what they do is they do training and technical assistance. So our storm, all of our data disruptors, the COVID, the age change, the new reports, the staff retirement, and the grant all together really had significant impact. It really rocked our systems, and it looked at the systems. It seemed to impact every system. So with relation to state, we had new people, we had new systems, we had new reporting requirements. Regionally, we realized that when we had people at the individual regions, we were able to get communication out quicker when there were disruptions. We were able to get, there were relationships that were a little bit closer to the LEA level. So we had some issues regionally. District-wise, we realized that because of our disruptions and things that have been impacted were training that had been needed. We had a little less interest in Indicator 7 from our LEAs than we had thought. We thought everybody was going to be extremely excited that when we finally got these reports out, with all the hiccups that came along with it, when we finally got these reports out, everybody would be just jumping and all wanting to come look at their data with us. We had to do a little cajoling there to get people to do that. The other thing that we realized too is we realized that we had put a lot of time and effort in really training our providers more on the best practice and the content thing rather than as much on data procedures. But the same thing was true. We had put so much training on our providers. We also saw that when we were looking at the data enhancements and trying to get out reports for LEAs to use, that we had not provided that much training to LEAs to be able to use from their perspective. And then the provider level with our standalone application, when we started trying to get the new reports out, we had some data disruption delays. We had some times where the application was down. We had some times where the application was actually pulling data that wasn't, you would run a report and you wouldn't consistently get the same thing each time, which is a big problem. So also in the new look of the application. So what we did is we started the big cleanup. So let's go to the next slide. So what we did is, as I said earlier, we were really excited. We tried to keep that continued motivation after every hiccup came. We tried to be resilient and persistent, but we had a really great team. So we actually did get through it. As you can see, we're here. A couple things that had happened is when we were doing the age change, we had to really deal with some of the, we had done the pros and the cons. There were a couple unintended consequences that we came across by changing our age age range by having exit happen the year prior to kindergarten. For us, that means the end of K4 because we have universal K4. We had not anticipated that there would be a pretty significant data loss in that we have children that are kind of near the end of K4 and they're initially identified. Well, those kiddos would not receive 6 months of service. So we had a large number of students. So that was something that we really hadn't thought about, but we dealt with. The same thing with the enhancements. We had to develop a whole new set of training materials that were specifically targeted towards LEAs because finally the reports were completed, they were pulling from the correct place. And then when we were we assumed that there was a certain level of knowledge with relation to the progress categories and summary statements. That didn't happen. We had to punt and come up with a whole new training package to get everybody up to speed with that. The same thing when our data manager retired, many of us had to have a crash course in the application. And I mean, some simple thing as we needed to have administrative access, so a lot of things happened there. We also had to really make some really significant very quick relationships with our data manager was kind of the conduit where between all the IT people, and I'm sure I don't have the correct terminology here, all of our IT people, all of our database people, all of those people. Then we had our data manager who was working with the early childhood indicators. She was kind of the conduit to more of what I'm going to call the content or the process or the best practice or the training and professional development folks, which is our group. And we met a lot of new people really, really quickly. We also learned that in the past, it was amazing how quickly reports would just show up and how they would pull the right things. We did learn that all the things that happen in the background. So that was a definite thing. So we learned a lot of stuff along the way. What we did is some of the big takeaways or lessons learned that we actually learned and incorporated. I'll show you on the next slide. So some lessons learned. So this one is so basic, but everybody needs to make sure that whatever role you're in, we need to clearly make sure all of the policies and procedures are clearly in writing. And then no one person is the keeper of everything. That we really need to make sure that things are in writing, but we also have that shared knowledge. The other thing is we really need to realize that we need to have stronger collaboration between departments. We had used one person as the conduit. We needed to make sure that we had that a bigger scope and it was more of a team approach. Really kind of shared development meant shared knowledge, which was something we were really looking that we really needed. One thing that was really nice, our assistant director, when the staff change took place, must have had this happen before or was clearly definitely in the know, but she immediately set up weekly meetings between the IT and the data group and our content and professional learning group so that we all would be learning it all together and we'd all be able to foster those relationships. The one other thing we learned is we actually, after this, we went through all of our resources and materials on child outcomes. We kind of did like a systematic review of what we have been supporting LEAs with. And as I said earlier, we realized there was so much emphasis on best practice. So the thing that we realized is we don't have a technical assistance guide, for our manual for our application, things like that. So we have kind of gone back a little and we're trying to do more resources that on the technical aspect. And with that, what also happened is our TA providers, our state TA providers, and most of them had been in the past regional TA providers, we needed to really look at their professional learning and we needed to boost up their technical end. They were experts and fabulous content providers when it came to best practice, but now that more and more questions were coming on the technical end, we definitely need to work on that. Another thing that we did is we continued our contact with national TA providers. We have used them a couple different ways. We have used them more to bounce ideas off and to be able to find out what states are doing what and kind of ask those questions and do problem solving with so that we don't have to reinvent the wheel if another state is doing it. But then also it's been nice that some of the national TA providers have been able to kind of foresee some of the problems as we were going through the outcome cohort when this all kind of happened. So that was nice. We now, in the past, we've done data reviews at at the state level, but they were not, they kind of were when they needed. So now we have regular state data reviews. Well, an unintended consequence is we've actually developed kind of, for lack of a better word, a data protocol that we're using in our work now. We really saw the importance. And what we've established with our data routine is that we now are trying to have a common, consistent way that we interact with data, and that we use data. We have the policies as to who does what and how it takes place. Our data protocol has kind of given us a little bit more focus around collection, analysis, interpretation, and then also using our improvement strategies. And that's another unintended consequence that happened, is as we were talking from our perspective from content and PD providers, our technical assistants, our IT personnel and data folks definitely, I think, got a much deeper, wider view of what was actually taking place with child outcomes, because it's kind of complex at times. And then the other thing we did is we really are using our data on a very regular basis now, and that as interruptions and disruptions come up, we're making sure we have much more clearer communication protocols that we're getting out across the state, and then we make those adjustments as needed. And then finally, we're always making sure that we're trying to be a little bit more anticipating what some of the things could happen, because remember I said before this, all life just went really smooth. It was amazing how smooth our indicator 7 actually went. So I guess we're ready for the next storm. We are stronger. We have more intentional systems. I think we will, and I guess no matter what, we're always going to have more storms. At least we'll have some things in place to be able to weather those. We feel pretty prepared. So I guess we're ready. We're ready for the next Wisconsin blizzard, and we'll see what happens.
Thank you, Michelle. And I don't know, Jenny, do you want to mention about any more about your chat comment there about the data use agreements?
Oh, I was just going to say that was one, right, that was a problem. When Michelle talked about when we had our TA providers regionally, they had access to districts that were located in their region. But oh my gosh, to try to get them access to statewide data, that was something we weren't expecting. And there was some difficulty there in trying to make sure the right people, they didn't know who they were, this kind of thing. So that was also one. And then I just wanted to say one more thing about the what we've learned. And everybody, I'm Jenny Bidler, the 619, and oversee the grant that Michelle leads with our TA, our technical assistance providers. One thing is, she talked about our Part B data manager. What is interesting about that also is she is on a 14-month vacation because she had been at the department for 35 years. So that's another disruption, is we are not able to hire one. So we're going to be limping along for a little bit, but like Michelle said, we're learning. So there's something that I think is unique to staff. And then the last thing is when Nancy was so good at what she did, what I'm learning now is when there was a problem and there was a question, when an LEA said, I can't get the outcomes to lock, I can't get my 3 entry outcomes to lock into the application to submit to you because of something, a glitch or something. Nancy, who basically wrote and owned the system, would go in and manually just really help. She was really, really trying to help LEAs. Said, oh, don't worry, I'll just take care of that. She would go in and manually edit things, and she would actually change the birthdays if they needed to. She would change the spelling of the name. So now, of course, that she's gone, our team is, when that's happening, we're realizing that although that was good, between Nancy and the LEAs, it's not very systematic. So as we report this to our IT staff and our programmers, they're actually taking those pieces that she would go in and manually edit, and we're pulling those to the surface, and they're actually working on some of those things at the systems level, so that the application itself can take care of those. And so we're learning that when one person owns the system and runs the system. So that's another thing that our programmers and IT staff didn't realize that was happening, or they would say, oh, Nancy used to just go in and sort of take care of that, but we didn't know really what's going on. So now we are working as a team and starting to address some of those mismatches so that the system can take care of some of those things and not just one person. And I think that's also an interesting piece of when a staff member leaves, who has had so much basically input and owned an application. So just wanted to throw that out there too. Thank you.
Very interesting.
Thanks for having us.
That was my fault for not introducing you first. Sorry. All right. Well, any questions for either Susan or Michelle before we wrap up? Any other comments? Curious to see before we move on to closing up. We have one more quick poll for you. What precautionary measures have you taken? What sort of proactive steps have you taken to prepare for a disruption? So there's one more poll that Mallory's going to display for us. We should have put a none on there. That actually. Then that, if you haven't, that's okay, because now maybe after today you will. Curious if a couple of responses coming in. Okay. Just another couple seconds and then we'll see. Right now it's looking like a little bit of everything. If you want to go ahead and display that, Mallory. Can you all see the results? Yeah, okay. So a little bit of everything. Looks like the most common one is providing advanced communication about planned downtime, whatever method you might use for that. Some of the other ones there look to be pretty evenly distributed. I don't know if the individual who selected other might want to unmute yourself and share. I'm not sure who that was. Okay, if you don't. Okay. All right. Well, thank you for sharing that. We're just curious to see where folks stand with some of those action steps. So as we know, as we've heard, these disruptions happen, and things you can do in advance to prepare for them can help minimize the consequences and impact associated with them. The different types of disruptions have different considerations that you also heard. And each state will have their own unique circumstances to consider when planning for this. One that Susan brought up in hers, that the fact that her state was so small, they were able to allow their locals to determine their own way in which they were going to collect and submit their data when their system was offline. So we are here at DaSy to support your work in either preparing for or responding to disruptions that you may experience. So please don't hesitate to reach out to us. We do have, oh, I see Deborah from South Dakota. Oh, okay, gotcha. Thanks, Deborah. Yeah, I should have had another option on there. We do have another resource that is coming out. So this resource was developed in conjunction with this webinar to offer general considerations for what leaders can do before, during, and after data system disruptions. It gets into more depth about potential impact and action steps that can be taken with regard to those three categories of preparedness: people, processes, or people, users, processes, and technology. It's currently in the final stages of review and approval in terms of its development, so we expect it to be released really soon. So stay tuned for that. We'll certainly send a message out through our listserv and on our website announcing its release. So,
Amy, can I add two more tools to that list as I listen to everybody? So my name is Chris Kelly, and one, thank you guys for your presentations and being willing to share about your experiences. I think two more tools or a couple more tools to add as I listen to you all are, one is the data processes toolkit. Susan, as you were describing the process that you went through, once you were able to fix your system, documenting that through the data processes toolkit would be quite helpful and help you think through all of this. The other is the data governance toolkit, which could be helpful upfront and helps you think through these things before they happen. I think also to the DaSy framework addresses some of these very issues through the framework, but also looks at strengthening your data system. So a couple of other tools that might help you all as you go through these processes and think about the future and potential disruptions that will probably never occur again, hopefully. But I think it is the wave of the future, right? I think we need to all prepare for data disruptions at some point.
Okay. Thanks everyone for participating with us today. And again, thank you to our Alaska and Wisconsin friends. We really appreciate you sharing all of this information. It's super helpful and interesting. So please, you will have a webinar evaluation in your email probably already. If not, it will be there shortly. Please take some time to give us feedback. We certainly do use that when planning future TA activities. So thanks again and have a great afternoon.